African time. This is the Health Brief half hour as per tradition here on the Journal every single Wednesday. As we mark Women's Month, I think it's worth asking whether women truly live or are living their healthiest lives at every single stage of their life's journey. While progress has been made, many women still face significant health challenges from adolescence right through to, the older stages of life, if you will, or the golden years, as I love to call them. Beyond reproductive health, issues like mental health, chronic diseases, gender-based violence, and unequal access to healthcare often go unaddressed. So this morning, we're actually going to explore those gaps. We're going to look at where these gaps persist and what a more holistic and integrated lifelong approach is to women's health and what it could possibly look like. On the line with me, Dr. Zoe Duby is joining me in her capacity as a socio-behavioural public health researcher at the South African Medical Research Council. Dr. Duby, it's a pleasure to speak to you once again. Welcome to Channel Africa.
Good morning. Thanks so much for having me on your show again.
Thank you. And I think this one, a very critical subject matter, looking at women's health, but really looking at it from several lenses. But I'd like to start with how we perceive women's healthcare at this time. Women's health is often discussed in separate chapters, adolescent stage, pregnancy, HIV and AIDS, for example, menopause. Is that the right approach?
Thanks. It's a very good question. So the issue is when we divide women's health into these separate chapters, as it were, as you describe, we really risk missing the sort of connections between those life stages. And obviously, there are different health challenges that are specific to those different times in a woman's life. However, they are all interlinked, and a woman's choices will affect her throughout her sexual and reproductive life course. For example, the contraceptive decisions she makes, the pregnancy, childbearing decisions or journey she undertakes, her HIV prevention decisions will affect her throughout her life. As well as mental health, throughout that, and her confidence in seeking the best healthcare to suit her at those different times of life. And what we know is that all of the decisions that a woman makes throughout her life journey, do not occur just as an individual making isolated decisions. They are all affected by, for example, gendered power, relationships that she's in, the decisions she's able to make, what kind of socioeconomic situation she lives in, sort of household poverty, for example, the kind of healthcare that she's able to access, if she knows how, if she knows where, if she's able to do that. So we really have to look at this kind of holistic life journey. And later on in life, where a woman is not able to access the healthcare she needs, she may live in great discomfort. There may be issues around stigma, talking about menopause or accessing information about menopause. So throughout the whole life journey, we really need to look at sort of trust and confidentiality and we call it responsive care. We really look at the specific needs of a woman at those different life stages and try to deliver services and enable her to access the services that she needs at that point in her life.
Right. You mentioned some very critical pointers there, Doctor, in terms of, the challenges that women face today and how they're interconnected with, the economic inequalities, the gender norms, where they are geographically in terms of how they're able to access healthcare and clinic services, if you will. But where do you believe then, with all of that said, where do you believe the biggest opportunities lie in being able to start breaking these cycles?
Well, it's a good question. So, it is very complex, and we have to look at the kind of circumstances that a woman lives in, because even if she may want to make healthy choices about her life, she may not be able to. So if we ignore, situations of poverty, unequal power in relationships, exposure to violence, even living in a rural area where there's limited access to transport, she can't get to a clinic. There are issues around safety. All of these are issues. But in terms of the opportunities, we can really look at starting with young women who are still in school, trying to improve educational attainment, access to social support is absolutely critical. And try to work with men and women and girls and boys to try and challenge some of the gender norms that limit girls' opportunities or their agency to make decisions about their own health, and about their health-seeking behavior. Really looking obviously at gender-based violence. That's something we're very aware of in our communities, where young women are too scared to make certain decisions because of reactions from parents or partners. It's really critical to provide services, youth-friendly services to young people, but services that meet, people where they are at with the needs that they have. Building safe spaces where women can access information, they can access the services they need without fear of judgment, without fear of stigma. And again, we look through, the various life courses. So during adolescence, we have to talk to young girls about preventing pregnancy so that they can stay in school, about HIV prevention, but really look at the individual and the sort of school system, the family system, the health system, and all of these things which challenge a woman's ability to make the healthiest choices about her life. And obviously not forgetting mental health and psychosocial support in that.
Absolutely. The stigma, the word stigma really sticks out at this time, because there's a lot of that going around. And I think it's worth addressing that and staying on that note just a little longer, Doctor, in terms of looking at I think it's also worth noting that there are quite a lot of advancements in medicine and public health. But there is still a disconnect in terms of how women are still able to access these healthcare facilities and treatments on a timely, in a timely manner, in a respectful manner, for it to be responsive to their realities. I mean, let's talk about that. Where is the disconnect between women being able to access medical health care and these advancements and the medical fraternity? Are we speaking different languages?
It's a very important point. And, while we don't want to point fingers at our very hard-working healthcare workers across the country, there are a lot of challenges. Our health system, particularly the public healthcare system, is very overburdened. And we do have these wonderful medical advances. South Africa has a very impressive healthcare system. Most recently in the media, we've been talking about the new HIV prevention injection, for example. So there are these wonderful technological advances, but it doesn't mean that they're accessible to the people who need them most. And even when women, and particularly young women that our research has focused on, they try to access healthcare, but often it is disrespectful. They fear judgment. A teenage girl trying to access contraceptives to try and make healthy choices and improve her chances of staying in school. She may be treated disrespectfully by a nurse who doesn't believe that a 15-year-old should be using a contraceptive. But so there are, these create challenges and barriers to accessing healthcare that is non-judgmental. We also have just the physical realities. People travel a long distance to get to the clinic. Once they get there are queues, there are stockouts of medications, there are confidentiality breaches, there are very overworked healthcare providers. So there's a lot of issues there. But also, outside of the clinic level, within our families, we have communication issues. Young people cannot talk to their parents about sexual issues, about their bodies, about their health. In the school environment, there are a lot of challenges there with teachers could be a fantastic avenue for support, but there's students feel that they can't trust their teachers. They can't go to them with, health questions, for example. So there are a lot of barriers to accessing these services. And I think what we really have to look at is, although we have things like PrEP and HIV prevention medication that is theoretically accessible to all pregnant and breastfeeding women who are, very high at risk, the fact is that women can't adhere to something like PrEP. They can't take a daily pill for various reasons. So we really have to look at the reality of women's lives and their relationships and empower them with the information, but also with the environment that helps them make safe, healthy choices that really suit them at that particular point in their life, and try to address some of those barriers to accessing respectful, safe, confidential, and non-judgmental healthcare.
Right, the runway to, freedom in terms of, the economics of women and how this then affects the medical space is quite a big deal at this time. And that's exactly what we are addressing. We're looking beyond reproductive health, but how some of these issues also interlink with mental health, with chronic diseases, with gender-based violence when it comes to women being able to access quality healthcare. We take a break and return.
Celebrating women, changing communities, countries, and the continent. Women's Month on Channel Africa. Keep Africa in your hands. Connect to our website for all your news, sports, and cultural updates. channelafrica.co.za. Channel Africa and you have got something in common. The thirst for knowledge. The Health Brief on the Journal.
We'll continue with the health brief, looking at women's health during this Women's Month here, as we acknowledge it here in South Africa. Of course, Dr. Zoe Duby joining me in her capacity as a socio-behavioural public health researcher at the South African Medical Research Council. Dr. Duby, let's talk about healthcare systems. I think it's wonderful that you note how overburdened the public health system is, but how can health systems begin to support women? I mean, that's a difficult question considering the lack of resources and all sorts of other inconsistencies that are happening within the sector. How can healthcare systems begin to support women more holistically through their lives, as we noted in the beginning of the conversation?
Yeah, thanks for that. So I think what's really important is that we look beyond a once-off, we call it, event-based healthcare service. So we look at continuous care throughout a woman's life, so that she doesn't have to seek out separate, isolated services that within, we call it integrated services. So when a woman goes, for example, for family planning to access a contraceptive, she should be offered HIV testing or HIV prevention or treatment. We should look at sexually transmitted infections, and mental health, basic mental health screening should be incorporated into that. And you talk about, it's not only about sexual and reproductive health, but chronic disease, talking to women about perimenopause and about menopause. So to really look at sort of trusted healthcare systems, and we can look at task shifting or task sharing. So you're not adding more burden to the already overburdened nurses in our public sectors, but trying to sort of differentiate the types of places and spaces where women can access psychosocial support, healthcare, and information. And it's really critical that women are empowered with information. That is, out with the media, with internet, there is so much misinformation out there, to really try and make sure that people have trusted sources of accurate scientific information. And really making sure that some of the most vulnerable women, those who are really living in the poorest households, those who are from LGBTI communities, people living with disabilities, homeless women. So we really have to look at some of those most vulnerable women and make sure that they are also reached by services, and to look really across, the woman's life, and so we call it, the life course of how to be flexible, offer counseling, offer integrated care, whether she's pregnant, whether she is trying to prevent a pregnancy, whether she is aging, and we look at osteoporosis, for example. So to try and look at the changing, shifting needs of a woman across those different parts of her life, and to really try and make sure that her needs are met throughout that.
Mm-hmm. Absolutely. I'd like to get a sense from you on the importance of research in this conversation. How important is research in being able to help us to move from just talking about women's health challenges to actually developing the right solutions that improve women's health throughout their lives?
Well, that's, I am with the South African Medical Research Council, so we really, we are very research focused. And I think it's really important that policy that we have is informed by evidence. So the work that I specifically do is qualitative research. So we listen to people's stories to really try and get their voices about what works for them. We know, for example, that many young women would like to have a contraceptive but cannot access it. So let's hear from the young women themselves about what makes them reluctant to go to a clinic. Why aren't they accessing those contraceptives? Because numbers and statistics are helpful, but hand in hand with that, we need the stories behind those statistics. So to help the Department of Health make decisions about policies and design a health system that is responsive, we need to understand the reality of people's lives and the challenges that they face in their everyday lives and in their health decisions. So we really try, at the SAMRC to interact with policymakers, to get the message out there, to translate what we are finding out in the scientific research into more accessible products, with the media, working with government departments, and working with communities to really try and ensure that people do have evidence-based information with which to make decisions about designing the best healthcare systems, about designing information materials for communities that really meet their needs and answer the questions that people have. So that's really where research is really important, to try and understand the needs of South Africans.
Absolutely important. Dr. Duby, thank you always. I think it's always just so valuable to have you contribute and share information so generously with us on the program. And happy Women's Month to you. Thank you very much for your time.
Thanks, and to you. Have a wonderful day.
Thank you, Dr. Zoe Duby, socio-behavioural public health researcher at the South African Medical Research Council, having a really critical conversation around what we're seeing in terms of women's health, reproductive health, mental health issues, chronic diseases, gender-based violence, and the unequal access that women still face when it comes to healthcare, and how these can be addressed at this time, especially as we acknowledge Women's Month, 27 minutes into 11.